Hello and welcome to another episode of Carnivore Evolution. I'm your host, Victoria Olson, with Mark Ennis, and our co-host today is Nancy Brown, who's a nutritional therapist and restorative health practitioner. And our guest today, our interview guest, is Dr. Dr Myhill. Hello and welcome to the show, Dr. Sarah.
Thank you so much for inviting me. It's a pleasure to be here.
Oh, we're so thrilled you're here. Yes, we'd like to ask you, would open a little bit, starting with a little history about you. If our listeners are unfamiliar, if you give us a little précis of who you are and what you do.
Oh, yes, of course. I qualified as a medical doctor in 1981. Since when I've worked full time, initially as a general practitioner in the British National Health Service. And then in 2000, I went independent, because I realized in the 1990s increasingly I didn't have the clinical freedoms that I needed to be a good doctor. My practice was constantly being restricted by National Health Service diktats. So I went independent, which of course financially was the worst decision I could possibly make, but intellectually and morally was the best decision I ever made. Because the problem with medicine in this country, and I'm sure it's the same in the USA, is doctors don't ask the question why. They are not looking for disease causation. And the medics in this country are educated by Big Pharma. Big Pharma's only responsibility is to their shareholders. One of their mantras is, a patient cured is a customer lost. They don't want patient cures. They're not looking for root causes. And so medicine in this country is increasingly going down the drug route, which is symptom suppression. And symptom suppression is dangerous medicine, because symptoms are our early warning system. They're symptoms, a little yellow flag saying something's wrong, do something about it. So I wanted to do something about it. I wanted to look at root causes of problems. And that's what drew me into naturopathic or ecological or functional medicine. It's all the same thing. It's all about asking the question why. Because if you know the mechanisms of disease, if you know why somebody's got a symptom, then that has obvious implications for management. So that's where I've come from. Here we are, 44 years later. I'm still on a very steep learning curve. I promise you I don't know all the answers, but I do know all the good questions.
Wow. Well, you know what? It's amazing, Sarah, that you've come on, because we all know that it's very, very hard to get doctors on, because they're the experts. They know what they're talking about. And it's actually reassuring to hear a doctor talk sense because I have this all the time with doctors on social media. I'm just saying, look, I'd love to have you on for a conversation. I'd love to have this debate face to face with you. I only spoke about this to Victoria the other day. 2 years ago, I spoke to my local doctor. My family members were going through a hard time. And I only asked him the question, like, listen, do you know what cholesterol is? And he said to me there was good and bad cholesterol. The minute he said that to me, I was like, okay. Because I knew what I knew, I was like, okay, we're in deep trouble here. So it's actually very, very reassuring to hear a doctor come on and start talking sense for once.
You know, Mark, you are so right. In the Victorian years, the Royal Society used to run these huge debates. The classic one, of course, was the evolution debates. But doctors won't allow themselves to be cross-examined individually and really have a deep dive into their knowledge, because they know it's so superficial, it won't stand the scrutiny of proper questioning. Now, I say I don't pretend to know all the answers, but at least I have the decency to say when I don't know, I don't know. But when I do know, it's worth knowing. And the joy of not knowing is you walk around with all those questions in your head. And what that means is when you see an answer, when that door of opportunity opens, you recognize that that's the answer. And you jump through it and think, oh, that's interesting. Let's try that. Because medical practice is called medical practice for a good reason. It's practice. And every single patient is another experiment. Now, I can give you some ideas from experience, the sort of experimental details that are most likely to work. But it is still an experiment. And as doctors, we have to be humble, learn from our patients, try this, try that. If they're moving in the right direction and they're getting better, fantastic. We've got a winning formula. But if they're not...
But can I just ask a question, though? Why can't we not just work together? Why does it have to be their way and it's only their way? I don't understand why we just can't work together. At the end of the day, we're just trying to help people.
Of course, but
Why is this agenda against, them against us? I don't get it.
You put your finger on it. They don't want to help people. They are educated by Big Pharma, and Big Pharma is all about making money. And the awful thing is if doctors step out of line, if they don't follow the narrative as laid down by big government, Big Pharma, and dare I say it, in this country, the General Medical Council, and in your country, the medical state boards, they get struck off. So the doctors are controlled. And as we speak, I'm launching a campaign for free speech and freedom of clinical opinion within doctors, because I have endless number of my colleagues, friends, like Dr. Jane Donegan, like Dr. Anne McCluskey, like Dr. Sam White, Dr. David Carton, and all these people who have been struck off, not because they've done anything wrong, not because there's any patient complaint against them, but because they have said stuff which is against the narrative, as it's called, which might be, they're anti-statins, or they have concerns about statins, or they have concerns about other procedures, which I dare not name because it will get taken off YouTube, but I called it the Voldemort factor. And they're not allowed, clinical freedom of opinion, which is an outrageous state of affairs, because not only is that an absolute break of the Hippocratic Oath, it's also completely against any medical ethic, because when I sit down with the patient in front of me, my only concern should be that patient. I have to do what is best for that patient, regardless of what happens to me. If I get struck off for saying that or detailing that, well, that's my lookout in it, but it shouldn't be that way. I should have the freedoms to say exactly what I think. Then that patient can
100%. take. I don't want to talk over you, ladies. I'll let you jump in there. So I just want to ask one more question. Yeah, I think it's unbelievable that we get to the root cause as quick as possible, because we can see what's going on in the world now with the power of technology. I say to doctors all the time, I say, you guys need to wake up now, because in 5 years' time, the way technology is going now, you're not going to have a job. Everybody can go on to AI now, and they can get a treatment done. You look at what happened during COVID. You weren't even seen by a doctor.
I know.
It was crazy. Like, you were looked after over the phone. I mean, how is this happening? And I can tell you now, this is what's going on at the moment. AI is trying to take over, and these doctors will not have a job very, very soon. I can see it very, very quickly. In the next 5 years, everything's going to be run off a system. Now, how can you tell me that's right?
How can you tell me? Sometimes I feel ashamed to be a member of the medical profession, because they are not free-thinking individuals who are doing their best for that person sitting in front of them. They are just trained puppets of Big Pharma. And you are so right. It's going to be AI, and then they're going to be paramedics who will do the hands-on stuff. But believe you me, they will miss pathology, because such the importance of being an educated and experienced doctor is you kind of get a feel for things. You see patterns, you recognize, oh God, this person is seriously ill. Oh goodness me, we can't hang around with this. And that's going to be lost, and it's going to result in more delay of diagnosis, and it might stem the flood temporarily, but it is not the way forward in the longer term.
Yeah.
One would hope that maybe AI might learn to think in those terms, but it can also be programmed to not think that way.
Correct.
To eliminate certain information.
AI is only as good as what you plug into it. And if it's plugged into the Big Pharma narrative, and guess what, of course it will be, people end up going down that route.
Absolutely true. Well, we know that your particular protocol, which we will question you about in a little bit, always is an approach by diet. It starts with diet. Is that correct?
Always.
Assumption?
My view is that most Western disease has two major drivers. One is poor energy delivery mechanisms, and the other is inflammation. And that's the overall strategy. And when it comes to poor energy delivery mechanisms, the analogy I like to use is the car analogy. So if you're a car to go, you've got to have the right fuel in the tank, and that's all about diet and gut function. You've got to have some oxygen there, and that's all about breathing and circulation. You've got to have good mitochondrial function, and that's my area of special interest where I publish, because mitochondria are the engines of our car.
Yeah.
It's mitochondria
Yeah.
which take fuel from the bloodstream, burn it in the presence of oxygen to generate energy. And of course, the preferred fuel is ketones, which come from fat. Fourthly, we need the thyroid accelerator pedal, which controls how fast mitochondria go. And fifthly, we need the adrenal gearbox, and that allows us to gear up in response to stress. So, if I'm a primitive woman trotting through the jungle and a saber-toothed tiger jumps out at me, I need to run the fastest 100 yards I've ever run in my life to stop becoming its breakfast. And for that, you need adrenal hormones, you need adrenaline. And so not only do I think of those things in that structure, but we have to do it in that chronological order. It all starts with diet and gut function. And then, as I say, we can touch on oxygen, and then the mitochondrial engine that obviously needs the right fuel in the tank, ketones. It needs a few raw materials. It needs freedom from toxic stress. And then, as I say, the control mechanisms.
And it makes perfect sense. It makes absolutely perfect sense, because when we look at like oxidative stress and what people are going through at the moment, like mental health, work life, lifestyle, all that kind of stuff, all factors into what you're putting into your body. Because that's the one thing you will always have control over. No matter what's going on in your life, whether it's external stuff, you will always have full control over the food that you put in your body. Now, if you put the right food in your body, it has an impact on other things. You're able to do other stuff. You're able to go, like a lot of people say to me, I struggle to get up and go to the gym. And I'm saying to them, don't be forcing yourself to go to the gym. Give your body the tools first. Give your body the food, and then you'll be jumping up out of bed, and then you'll be going to the gym.
Correct.
Whereas we're doing the opposite. We're just telling people, if you're overweight, just go to the gym. And just go on a low calorie diet. So you'll go and see your doctor, and he'll say to you, you're overweight, but you just need to you need to lose weight. Like, okay, that's great advice, doctor, but I need more than that. I need you to tell me, why am I struggling here? Why am I struggling with my mental health? Why am I depressed? Why have I not got the energy to go to the gym? Why am I sore when I'm actually doing my workouts? How come I can't recover from my workouts? I need you to tell me why I'm thinking about food all the time. We see what's going on in the world at the moment with food noise. Everybody is struggling with obesity. They have no idea why they're thinking about food all the time. But all of a sudden, we brought out the solution. We just brought out the solution, a weight loss injection, and now we solved the solution. What?
Yes, Dr. Myhill, please tell us, speak.
No, but all those symptoms you are detailing, they're all symptoms of poor energy delivery mechanisms.
Yeah.
And 99% of the population have got the wrong fuel in the tank. They're fueling their bodies with sugars and carbohydrates and ultra processed foods. Why? Because those foods are so addictive they can't stop eating them. And weight is a hormonal issue. It's got very little to do with calories. Yeah. It's all about hormones. It's all about satiety hormones and adrenaline and all that. In fact, I'll just tell you a quick story now. In the 1960s and the 1970s, the big money was being made by the tobacco companies. And, we know, the tax on cigarettes is huge. And they make money from cigarettes. Now, they had a team of scientists in the 1970s and the 1980s who were there making cigarettes as addictive as they possibly could. And the two big things they would put into the tobacco was extra nicotine and guess what? Sugar, in order to make that tobacco more addictive. Now, when, the health people came along, quite rightly said smoking is really dangerous stuff. We can't do that. The tobacco companies, notably Philips in this country, and Reynolds, I think it was Philip Morris in this country, and Reynolds in the USA. What they did is they bought up the food companies, and then they said to their scientists, now make food as addictive as you possibly can. And so their scientists turned their attention to food and realized that what people want is that right balance of saltiness, sweetness, fattiness, crispness to make foods addictive. And they've come up with ultra-processed foods, which are all, of course, high carbohydrate diets. And although it satisfies in the mouth, it doesn't fool the gut hormones. The leptins and the ghrelins say, oh, that's rubbish food. You haven't eaten anything worthwhile. Go and eat some more. So, of course, it makes them food addicts. And they're eating more and more and more
Mm.
to satisfy, and they
Yeah.
can't do it. They put weight on.
And isn't it amazing when they brought out the weight loss injection? That's what it does. It targets leptin. It controls leptin. It controls your insulin. But people don't understand that if you just have like 12 eggs on its own, it does the exact same thing.
Correct.
A ribeye steak on its own does the exact same thing without
Correct.
the side effects.
Correct. In fact, I'm going to tell you a story now. I had a friend of a friend come up and stay in in my house, and she was obviously an interesting person. So I'd come and have supper. She worked for the London Metropolitan Police in their forensic department. She takes the photographs of the corpses that come in, and they'd had 13 people come in who had died following those weight loss drugs, Ozempic, Mounjaro, and so on. She said she was taking photographs of the pancreas, which produces these hormones. The pancreas was a mush. Now, we are going to see epidemics of pancreatic failure, pancreatitis, and pancreatic cancer with those drugs. You watch this space. They are very dangerous drugs. I wouldn't touch them with a barge pole.
Wow.
Sarah, I'll give you another story, Sarah. Victoria is well aware of this. We interviewed a lady called Krista. She lives in the States, and she told us her Ozempic story. Now, this is unbelievable. Honestly, this story is unbelievable. She was given this Ozempic because she was overweight. She was a type 2 diabetic. The next day, she was nearly blind. Okay? But not only that, she fainted a few times. Her heart had stopped. She went back to the doctors and said, listen, like, what are you guys after doing to me? These people were blaming her. They were like, you came to us. You wanted to lose weight. You needed. Now, these people nearly killed this lady. And this lady, this doctor is still hitting her job. I mean, just think about that for a second. She was almost that close of killing this person. She has certs all over her office saying how amazing she is. But when it comes to this situation right here, when she almost killed one of her patients, we just let it go. Honestly, it's on. And I'll give you another one. Sorry, I'll give you another one. I work with a person at the moment who works in the health sector. Now, she's telling me these stories all the time. She told me 6 months ago, a 35-year-old came in, a type 2 diabetic, right? Type 2. It got really, really bad. They had to remove his leg, right? Now, after they removed his leg, guess what they fed him after the surgery?
Sugar. Pure sugar and fruit, I bet.
Like,
Unbelievable.
Unbelievable.
There's never been a single study of a hospital diet that demonstrates it's adequate in terms of, quality, quantity, micronutrient status, or whatever. Hospital diets are dreadful.
Wow.
No,
Well,
because
we have,
go ahead, Victoria. Sorry.
well, we have heard you say, Dr. Myhill, that the carnivore gut is a sterile gut. And by implication, we gather that that means it's ideal. Can you expound on that a bit and what you
Not
mean by
not entirely,
sterile?
Sarah.
And
The basically the gut is a tube that starts at the mouth and finishes at the anus. The first 25 foot of the gut, which I call the upper gut, you can never get a gut that's completely sterile, but it's near sterile. It's the last 5 foot of gut where the microbiome resides, which of course is full of friendly microbes, which, do much good for us. They synthesize vitamins and minerals, they program the immune system, they produce neurotransmitters and so on. But the upper gut should be near sterile. Now, and that is maintained by having a nice acid stomach. And when I say acid stomach, I mean really acid. It can be as acidic as pH 3, which is very acidic indeed. And pH 3 will kill all microbes. And this is a major defense against disease because 90% of infection comes into our body through the mouth, either because we eat it or because we drink it or because we inhale it. The microbes get stuck on sticky mucus, coughed up, and is swallowed. Now, if we and having a non-fermenting, sterile upper gut is vital for digestion and absorption of proteins and fat, for absorption of minerals, and for protection against infection. Now, what happens when people eat a whole load of carbohydrates? So breakfast would be, cereals and fruit juice and sweet drinks and whatever. And then it goes through the day with biscuits and pasta and chocolate and crisps and goodness knows what. is you overwhelm the ability of the upper gut to remain sterile, and the microbes move in and start to ferment. And the fermenting upper gut is a disaster. Now, I deliberately call it the fermenting upper gut because that might be by bacteria and it might be by yeast, but it's a disaster. Why? Because those microbes reside on the lining of the gut and they cause low-grade inflammation, and that results in leaky gut. You need an acid, and that means the acid leaks out, so you no longer have an acid stomach. So you are open to infection. You cannot absorb minerals efficiently, and you leak proteins and microbes into the bloodstream, which should never be there. So, my guess is one of the commonest upper gut fermenters is yeast. And if you eat a bag of sugar, which is if you eat fruit, for example, and fruit is a bag of sugar, and all fruit has got yeast coating on the outside. As soon as you eat fruit, then you will start to ferment by yeast. What do you produce? Ethyl alcohol. And not a little bit, a lot of it. I mean, thankfully, we have a fantastic liver that does its best to detoxify that alcohol. But it's not just ethyl alcohol that's produced. It's propyl alcohol, it's butyl alcohol, it's ammoniacal compounds, it's D-lactate, it's hydrogen sulfur, and all these poisonous. And as soon as people start to sort out their upper fermenting gut, they often say, oh, A, my energy is better, but B, my foggy brain has cleared up. Because if I had, half a pound of grapes for my breakfast, it'd be like drinking a glass of wine. And guess what? Yeah. I wouldn't get much done in the day. I'd be foggy and fatigued and no good at all.
But isn't it amazing that we've normalized, when it comes to things like bloating, you're walking around gassy, you have digestive issues. It's just it's normal after you eat a food. It's not normal. No. You shouldn't be going around breaking wind every 5 minutes.
Correct. And it's worse than that, Mark. It's worse than that, Mark, because the doctors will tell you, oh, you've got irritable bowel syndrome, as if that's a diagnosis. Yeah. And be grateful you haven't got cancer, sort of thing. But irritable bowel syndrome is either upper fermenting gut or food allergy or both. It can be easily sorted out. And as you say, it's pain, it's discomfort, it's antisocial. We don't need an upper fermenting gut. It's real bad news.
And then the diagnosis, if you have got IBS or any similar issues, it's like you need to add more fiber. So you're adding more fiber. You're adding more fire onto the problem. How does it make sense? It just doesn't make any sense how people are saying you need to add in more fiber when it's not even a nutrient. Your body doesn't even break down this food.
Correct.
The reason why we eat animal-based food is because the animals do it for us. Their stomachs are different to ours. Their stomachs are able to absorb this food. Why do we need to go out and eat a lot of vegetables?
We don't.
You know what I mean? There's a massive difference between fullness when you're bloated and then just satiety where you feel good about yourself. You're just full.
That's the key thing.
There's a major difference.
If you want. Correct. But I mean, there's always talk about, fibre, it's good for the microbiome. But what's so fascinating is that if you look at the microbiome of carnivores, it's just as diverse and just as healthy as the rest of as anybody else. And I think the key here is what people forget is meat has fibre. And one of the most important fibres is collagen. And collagen is the food on which Bacteroides and Firmicutes, which make up for much of the microbiome, that's what they're predicated on. Now, I have to say, I worried about the microbiome when I started first investigating the carnivore diet, but I learned something, Professor Nick Lane, about what microbes in the gut ferment. And if there's a microbe at the top of the tree which ferments collagen, that will produce a product, maybe lactic acid, which other microbes then ferment, and they produce a product which other microbes ferment. It's a little bit like the ditty. Big fleas have little fleas on their backs to bite them. Little fleas have lesser fleas, and so ad infinitum. So the point is there's a chain of microbes which start off with one substrate, and then it goes all the way down the line, and that's what makes for diversity. So I was so relieved to discover this, because suddenly, we have a good explanation for why the microbiome in carnivores is so diverse. And we don't know much about the microbiome, but what we do know is the more diverse it is, the healthier you are.
Mm-hmm.
Do
And that's
do
what we're
some
saying.
foods
Sorry,
do some foods
go ahead,
interfere
Nancy.
with the gut, particularly dairy and fermented foods? And then Nancy, please, after you answer my question, doctor.
Well, I'm not a fan of all dairy products for the main reason that dairy, I mean, again, whenever there's a difficult question, always go back to first principles. I always go back to evolutionary biology. Now, dairy products were intended for young mammals. If young mammals don't grow very quickly, they get eaten by saber-toothed tigers. So what that means is that milk protein is growth promoting. So my view is that the only safe dairy product is butter. And, I love butter, and that's included in the carnivore diet. So some dairy occasion is going to be fine, but we shouldn't have too much milk protein because of its growth promoting effects. So that's why I'm not too keen about dairy. And the other point about fermented foods, again, they sound like a good idea, but I now know that so much pathology is driven by allergy to microbes in the upper fermenting gut. So we have all these clinical pictures like inflammatory bowel disease, temporal arteritis, polymyalgia rheumatica, arthritis, intrinsic asthma, psychosis. These are not diagnoses, they're clinical pictures. And my guess is many of this is driven by allergy to microbes from the upper fermenting gut, because these microbes, they're not evolutionarily correct microbes. Because we've got enough fermenting gut, it's a leaky gut. They get into the bloodstream. They get stuck at distal sites. They get stuck in our joints, in our muscles to drive fibromyalgia, in our chest to drive asthma, in our gut to drive inflammatory bowel disease. And so the starting point to treat all those conditions of Westerners that, guess what, you don't see in primitive tribes, or the starting point is sort out the upper fermenting gut. And how do we do that? Well, stop feeding it first with sugars and carbs.
Mm-hmm. Oh, thank you.
Go ahead, Nancy.
Nancy, you had a question?
What is, Dr. Sarah, what is your thoughts on Akkermansia? Akkermansia, which
Well,
is
the answer is I don't really know.
Okay.
And because we just don't. I was just watching a podcast the other day of a guy who's done over 200 studies looking at the microbiome, and the main conclusion he comes up with is we don't know. So in situations when we don't know, always go back to evolutionary biology. And the fact of the matter is, us humans evolved as carnivores. So let's stick with what I call the bleeding obvious.
Mm-hmm.
Because there's been a lot of discussion, like even in the courses that I took and the training that I did, and some of the things that we did were studying the GI stool map tests and looking at that. And oftentimes, Akkermansia, for an example, is extremely low, if not detectable, and often in people on low carb or carnivore diets. So, there's that question. And Dr. William Davis, who you've probably heard of, who did Wheat Belly, and then he did a sort of a gut health book. And he talks about that's the big downfall of some of these diets. Oh, you can do that for a short time, but then people, they eliminate that bacteria, they eliminate those important microbes. And as a result, it's unhealthy. So I'm just wondering what your take is on that. What do you think about something like that?
Well, it's the old story. Don't place too much reliance on tests. As I was taught at medical school in the 1970s, 90% of diagnosis is the history, and the test just confirms. If that person is well, if they're functioning at a high level, and if they're not in an inflamed state and they've got good energy delivery mechanisms, then you're not doing much wrong. So the awful thing is, Nancy, I never ask for GI map tests because they're expensive. And I want my patients to spend their money on the best food they can possibly get. That is much more important than micromanaging tests. And, now I'm going to tell you a joke. And this pertains to a newspaper article I read some 25 years ago about a merchant bank that wanted to target its 100 wealthiest customers. So it set up this little scheme, sent the letter down to the printing department for a personalised letter to go out via mail merge. Now, the scruff in the mail merge department forgot to press the mail merge button, so the 100 wealthiest clients received a letter that opened up, "Dear rich bastard." The That's been subsumed by language.
Wow.
And so my patients are either RBs, they're rich baskets, or they're PBs, they're poor baskets. And guess what? 99% are PBs. And I don't want to be spending their precious money on expensive tests which are not going to change management. The single most important test is the response to treatment. So
Can I just
I
add,
put in.
Go. No, sorry. Go ahead. Sorry. Keep going.
So whenever I see a patient, I put in place the regimes that I know are absolutely essential for everybody. The diet, a basic package of supplements, some simple detoxing, good quality sleep, right balance of exercise, without doing any tests at all, because I know that done well will get them a long way without spending lots of money.
I was just going to jump in there because this is what we're seeing at the moment. I don't know if you guys are aware of what's happening on social media. We're seeing all these carnivores go back to carbohydrates because they're all getting these blood work done. They're all getting worried about the H1C. They're all going on about this. But I'm saying to these people, if I was speaking to these people directly, the first question I would ask them is, how are you feeling? Now, if they're turning around saying to me, I feel absolutely incredible, why do you need blood work done?
Correct, because
tell me why do you need it done?
Because the thing is about the blood work is the normal ranges are based on what we see in people eating loads of sugars and carbs because they're
exactly.
releasing
Exactly.
So the normal ranges are wrong.
Yeah, their H1C is going to be completely different to someone who's eating the standard diet who has a lot of sugar. You're gonna notice they're not gonna feel good. Whereas if you look at their readings, if they're on the carnivore diet, they're gonna turn around and say to you, "I feel amazing." It's because it's the same thing. You go and see your doctor when you get your blood work done. Because I've done it like a few times. The first thing he says to me is, "Mark, your cholesterol's too high," and I'm like, "Doctor, look at me. I feel incredible. Like you're telling me to lower my cholesterol, put me on a statin." I'm in the best shape possible. Like I'll be 53 in 3 weeks' time. I feel incredible, absolutely incredible. So what I'm saying is that if you're going to get blood work done, it depends on what you're doing. If you're in the carnivore lifestyle and you're feeling great, I would stay away from the doctor. I don't think you don't need a doctor. Like why?
I agree. I had a patient came to see me the other day, feeling really well. She's a brilliant carnivore. Her cholesterol was 9. I said, fantastic. I can show you studies where the higher cholesterol is, the longer you live.
Excellent.
Yes.
Wow.
Because we're all doing what the guidelines tell us. Everybody's telling us to go on a low-fat diet, but yet heart disease is still the biggest killer in the world. Like, how do you work it out? Honestly, how do you work it out? Saturated fat has been demonized for such a long time. There's not one study out there that states that saturated fat on its own was the problem. And if anybody read the Randall cycle, you will understand what's going on here. You need to understand, when they talked about saturated fats, they forget what else you were having with these foods. So if you're having a burger, what you were having it like with chips, a bun, alcohol, wine. There's the problem right there. It wasn't the cholesterol, it was what you were actually doing with the cholesterol what was causing the problem.
Correct. Cholesterol is not a cause of arterial disease. If you got it's a symptom of, because the so-called good cholesterol HDL is used up in the business of healing and repairing arteries. So I like to see the HDL above 2. If the HDL is above 2, your artery is in good shape. The so-called bad cholesterol LDL, that's essential for people who are in ketosis. Because that is how you access fat from your subcutaneous to go to the liver to make ketones. It's a vital part of health.
And we spoke to Malcolm Kendrick a few months ago. We did a 2-hour show on this. LDL is not even cholesterol. Like
I know
it's just a carrier. So why are we talking about LDL as a cholesterol molecule when it has nothing to do with cholesterol? It's just
correct.
This is the information that we're being given. It's just incredible. It's incredible.
Well, Nancy has a question coming up now.
Say something?
It's Nancy's question.
Yeah. I've got a few questions, but I
Mhm.
want to know what you think of fasting. How do you feel about fasting, whether it's intermittent fasting, whether it's longer term, as being helpful to healing?
Okay. Well, whenever we have a difficult question, always go back to evolutionary biology. You know, did primitive woman get 3 meals a day? No, of course she didn't. Of course she
Mm.
didn't. She feasted and she fasted. And the point about fasting is that after 16 hours of fasting, you switch on autophagy or autophagy or self-eating. And that's how she kept cancers and effectively did a kind of spring clean. So I'm a great fan of fasting. I think it's a fantastic tool. And what I generally suggest people do is, first of all, time limit their eating. So eat all your food within a 6-hour window. And the reason I choose a 6-hour window is because autophagy is switched on after 16 hours of fasting. And that means
Mm.
you get 2 hours a day of autophagy, which to say is like a spring clean. It's like how we mop up all those cancer cells. Because the fact of the matter is, we're producing cancer cells all the time. Throughout
Mm.
life, just from background radiation alone, generates about 10,000 mutations every second. So we're throwing up cancer cells all the time. But if you've got a cracking immune system that's busy, it's got the energy, it's got the raw materials, it goes around and gobbles up those cancer cells before they cause any problem at all. And then once a week, just do 1 meal a day, because that then gives you, another 6 hours of autophagy. And then once every 3 months, I do a 3-hour, a 72-hour fast. So that's spring, summer, autumn, winter. As the seasons come round, I do my 3-day fast. Now, the point is, if you are carnivore and in ketosis, it's I don't say it's easy, but it's much easier because, okay,
Yeah.
I might feel hungry, I might feel peckish, and guess what? I'm greedy. I love my food. But if I ask myself, is the brain working well? Yes, it is. Is the body
Yeah.
working well? Yes, it is. This is greed, not need. And of course, primitive man would have had windows of time of fasting. And the interesting thing here is that fasting has a very profound effect on energy delivery mechanisms. Now, again, back to evolutionary biology. What would have constrained human populations was food supply. Food was incredibly precious. So what happens in the autumn is we have a windfall, don't we? We have a harvest of free food. We have fruit, we have nuts, we have seeds, we have grains, we have pulses, we have root vegetables, and these are all carbohydrate foods. And the best evolutionary ploy in that event is to switch on the carbohydrate addiction gene, eat those foods and eat those foods and eat those foods, spike insulin and get fat, because fat is survival value for the winter. And in parallel with that, what we don't want to do is waste all that precious energy, playing rugby matches or playing football matches or doing silly things. We want to conserve that energy. And so it makes us fatigued as well. So the
Mm.
evolutionary ploy that allows us to survive is switch on in the carbohydrate addiction gene, get fat and get fatigued. So we enter the winter with loads of fat, and that survival value. It keeps us warm and it's a food source. But of course, what
Yeah.
happens in the winter is, we don't have those foods anymore. We run out of them.
Yeah.
And so we have to so we start fasting. And what fasting does is it improves your energy delivery mechanisms and it improves your brain power. Now, primitive humans were social animals, and we hunted by running down our prey. So we're not fast enough to sprint them down. I can't outrun a zebra or a deer,
Mm.
but if I run and run and run and run, eventually the animal wears out, comes to bay, and then we can kill it with sticks and stones. But to do that,
Mm.
you need the brain, get all your friends involved on the same hunt, and you need the energy for a long run, for a persistent run, and humans can outrun most animals. So the best ploy when you're fasting is to have more energy, because that makes you a more effective hunter. So it's
And
very
that's what.
counterintuitive.
So, go ahead, sir. Sorry, I keep on interrupting you. Sorry.
No, please do, Mark. They're much more fun when when we're having a bit of a
No,
bashing the ball around. But the point is,
no,
more.
I was just going to say, like, when we look at fasting, the problem is people take it to the extreme, because this is what people are struggling with. They're starving, they can't stick to a diet. Whereas when you are in the carnivore lifestyle, it just comes natural. Like I'm coming from a place when I used to eat like 10 times a day back in the day. I was eating like every 2 hours, and I couldn't understand why I was eating. But I had to understand the hormones when we were talking about hormones earlier on, and how powerful it is and how they actually impact how we eat. We shouldn't be feeding ourselves every 2 hours. It's so much easier
Yeah,
because
correct.
I wake up at 3 o'clock every morning, and I can tell you right now, the first thing I'm not even thinking about food. I'm in work mode. I can't wait to get started, and I'm getting everything done. And then when I'm ready, which is around 1 o'clock, around 12 o'clock, 1 o'clock, I'm nice and relaxed. And we go back to stress. I'm nice and relaxed, and I'm like, okay, now my body's ready to eat. And when we look at our ancestors, they went out and hunted the foods, and then when they were all sitting around the fire, they all sat down and they had their food. They didn't just say, okay, we found the animal, we're going to kill the animal. Now we're going to kill it and we're going to eat it. Now we need to track our calories and see how much we're going to eat. No, they killed the animal, and then they got everybody together around the fire, and then their stress levels were nice and low. So what I'm saying is they went out, they weren't like thinking about, okay, I need to do a lot of cardio to lose weight. No, they were going out to hunt the animal. So when we talk about the energy, they were using up that energy to kill that animal and bring it home and eat it. Does that make sense?
Correct. Correct. Perfect sense. That is how we evolved. In fact, I was interested to read that the samurai warriors, before any battle or altercation, they would fast for 24 hours. Why? They had more energy, quicker reflexes, and their brains worked better.
Mm-hmm. Can I ask
I'm
a
going to ask
question?
another question.
Sorry, Nancy, go ahead.
I just to follow up, sort of along the lines of what you're talking about. Have you got any feeling whether paleo is better, keto, just some standard keto diet is better, or carnivore? Like, or do you just say, well, it depends on the person. It depends because paleo, as far as I know, is you're eating seeds and nuts, and there's other things that you're eating that maybe are not that great for a lot of people. I'm just curious to know what you think about
Okay.
that.
Well, it depends how sick the patient is. Because if you look at life from the point of view of a vegetable, a nut or a seed or a grain, it doesn't want to be eaten. It doesn't want to be eaten by an animal, and it doesn't want to be attacked by a bacteria or a virus or a yeast. So the way that nuts and seeds and grains and pulses achieve that is they make themselves as poisonous as they possibly can. So all food that is not animal is toxic. Now, of course, we've evolved a fantastic detox system to help us to deal with that, but it can be overwhelmed. And it's increasingly overwhelmed in the modern world because A, many people have got an upper fermenting gut, and B, we're all poisoned. And that is a subject of a lecture which I could talk all day about. So the point about the carnivore diet is it's very low toxicity. And for somebody who is really ill, they're often ill for a multiplicity of reasons. They're ill for reasons of allergy, for reasons of high carbohydrate, but they're often ill because they are poisoned. And the point about the carnivore diet is a very low toxic diet. Meat doesn't have to be toxic because we can, animals defend themselves by having a good skin, a good immune system, and they can run away. They don't need to be poisonous. So meat and offal is the least toxic food we can consume. And so for a patient who's really sick, a carnivore diet is a great start.
And if you're giving your body the wrong food, well, then there's a place to eat fiber because you want to get rid of that food. That's the reason why the standard diet has this fiber in it. But if you're eating the carnivore diet, there's no need for that. Why do you need to remove waste on a daily basis? You're only removing the waste because when you're on the standard diet, because you're eating crap. So that's the reason why you need to get the fiber in, otherwise you're going to be clogged up. You're not going to feel good about yourself. But honestly, anybody who goes on the carnivore diet, go ahead, Sarah.
I think it's more interesting than that, Mark, because we have to ask ourselves, what is the mechanism of constipation? And giving fiber to somebody who is constipated is like adding more cars to a traffic jam. It's not going to cure it. And I think constipation is a friction issue. I think it's that there is friction between the lining of the gut and the contents of the gut. And friction, and this is another one of my favorite subjects, is all about exclusion zone water. And exclusion zone water, long story, is what renders surfaces in the body frictionless. And for exclusion zone water, yes, we need water, yes, we need fat, yes, we need heat. But what greatly improves the quality of exclusion zone water is sulfur. We're all sulfur deficient, and meat is rich in sulfate groups. So the fascinating thing about people on the carnivore diet is they don't get constipated. Okay, they might not poop every day, but when they do, it's effortless, and that is the key thing. Again, think about constipation from the point of view of the primitive woman. If primitive woman is trotting through the jungle, she can't afford to squat and strain away for several minutes to produce a turd, can she? Because it's like saying to a wild animal, "Come and get me! I can't move. I'm planted." It's not a good thing, is it? So I think constipation is not about fiber; it's about friction.
Absolutely. Can I just ask a quick question about going back to the fasting as well, because I want to get your take on this, Sarah. Would you implement fasting for someone who's struggling with sleep? Because for me, when I'm working with clients, a lot of them come to me struggling with sleep. Now, what I usually do is I stay away from the medication. I try and find the root cause and see if I can actually solve that very, very quickly before I start adding some magnesium in. Now, what I find is if you're fasting too long before you go to bed, this can actually impact your sleep. So what I do is I actually push the eating window very, very close to bedtime. Because when you think about it, when you have a meal, a good meal, and it's not too heavy in your stomach, you're gonna be asleep pretty much after it. When you look at what an animal does, when an animal kills its prey, it pretty much sleeps like say a half an hour later. I see this hugely with people at the moment who's really, really struggling with sleep because they've been told, okay, you need to go on a magnesium supplement, and I'm like, okay, well, no, hang on a second. I'm pretty sure we can solve this. Let's look at what you're doing. And most of the time, they're stop eating around 6 p.m. and they're not going to bed until around 11 o'clock. That's a 5-hour window without any food. Now, surely that's going to cause an awful lot of stress in your body. You're going to be energized. You're going to have so much. You're going to be buzzing. Surely that's going to disrupt your sleep. If you want to get into a deep sleep, I find if you have, and I do this myself, if I have a good meal about an hour and a half, 2 hours before I go to bed, I sleep like a baby. Like, I have the best sleep ever. What's your take on that?
Well, the major disruptor of sleep is adrenaline. Now, people are running on sugars and carbs. As we know, their blood sugar is up and down, their insulin is up and down, and their adrenaline is up and down. And the carbohydrate addicts typically wake at 1, 2 in the morning and they can't get to sleep. Why? Because they spiked adrenaline. And what often gives a clue is they say, oh, if I go and have a sweet cup of tea or something to eat, I can get off to sleep again. But with the carnivore diet, of course, the blood sugars are absolutely level. You've not got these uppers and downers, and so yes, you do sleep much better. So any sleep problem, the starting point is to get off the sugars and carbs, and that makes such a difference.
Yeah, 100%.
Alcohol contributes to
Sorry,
that
Nancy,
too.
go ahead, Nancy.
The other thing.
I'm sorry, you interrupted, Dr. Myhill.
The other thing is a very, very common problem is the underactive thyroid. Now, people who are carnivore, who are running on, they're fueling their bodies with fat. In order to be able to fat burn, you need thyroid hormones. Now, if you haven't got the thyroid hormones, the body will fat burn with adrenaline instead, and the adrenaline will wake you up in the middle of the night. So if I have somebody who is well keto adapted, who's running on fat, and they say, oh, I'm still waking in the night, I always think thyroid. And we don't just do the blood tests, I also look at the clinical picture. So this waking in the middle of the night is, it's called ketogenic hypoglycemia. You feel like you've got low blood sugar, but you haven't, because low blood sugar is not a symptom of low blood sugar, it's a symptom of high adrenaline. And that is often part of the underactive thyroid. So I would think thyroid.
Yeah.
Wow.
Makes sense.
So, Nancy?
Do you have another question, Nancy? Did you want to ask?
I was just going to respond to what Dr. Sarah just said. In that case, so you said you look at the clinical picture and then you would look at the thyroid blood tests, like all the different ones, in order to determine whether that is what it is, ketogenic hypoglycemia. Because I've heard a lot, and I had this experience myself, especially when I first went carnivore, was waking in the night. No carbs, nothing. I was eating quite well, good fatty, meats and all that, but I was waking wide awake, and not ready to get up yet. It wasn't a matter of, oh, you only now need only 3 hours of sleep. It was more like I just couldn't. I was wired. And that might explain that problem and that some people are having where they're
Correct.
they're not touching any carbs.
Okay.
They're following that diet and then they're waking up and they just can't sleep. So
Okay.
maybe that
Now,
would
the
address
point
that.
about the point about the thyroid is you don't just diagnose it on a blood test. So what the blood test tells you is where the thyroid hormones are lying. And if they're right at low end of range, you might feel much better running towards top end of range. So all the test tells you is if there's biochemical scope for a trial of thyroid hormones, if the clinical picture suggests such. So we then have to ask, what's the clinical picture peculiar to the thyroid? So a very helpful symptom is your pulse rate at rest. So and a good time to measure your pulse is first thing in the morning. You can feel it at the wrist with your thumb, which has got a little pulse in it. If your pulse rate at rest is much below 70 beats per minute, think thyroid. Other symptoms of the underactive thyroid, sleep disturbance. Very often people are owls. If they can't drop off to sleep until 11, 12, 1 o'clock in the morning, they don't wake until 8, 9, 10, think thyroid, because thyroid hormones are peculiarly responsible for our circadian rhythm. Edema. If you mix edema is another name for the underactive thyroid. So if you tend to have fluid retention, so if you wake up in the morning, crease marks on your face, if your vocal cords become edematous, then your voice changes. It comes all croaky like that, like what you've been smoking, when you haven't. Or some singers say they can't hit the high notes anymore because they've lost their cords a bit edema. Carpal tunnel syndrome, sciatica, nerve compression symptoms. These can all point to an underactive thyroid. Poor quality hair, loss of eyebrows, poor quality skin, dry skin. So there are lots of clinical symptoms and signs of the underactive thyroid, and you have to bring that into the equation. So don't laugh now. I've written a book called The Underactive Thyroid, and the subtitle is Do It Yourself Because Your Doctor Won't. And that is the shocking state of affairs. The doctors only look at the blood tests. And if the blood tests are within, population reference range, then they're all told, oh, your thyroid's normal, off you go. But we all have our own personal reference range for thyroid, which is not the same as the population reference range. So the population reference range for free T4 in this country is 12 to 22 picomoles per litre. In fact, Professor Sir Anthony Toft, endocrinologist to the Queen, or as she was, and then author of the British Medical Association of the Guide to Treating the Underactive Thyroid, he says some people don't feel well till they're running at 30 picomoles per litre. So 12 to 30 is a very wide reference range. But we all have our own personal reference range, which might be 20 to 22. It might be 12 to 14. So the point here is if your results come back at low end of range, there is scope for a trial of thyroid hormones. And the real diagnosis comes at the end of that. If you turn around and say, do you know what? I feel so much better. My energy's back. I've got that zip. My brain's restored. My hair's coming back. Then we can say retrospectively, yes, you had an underactive thyroid. We fixed it with thyroid glandulars, and everybody can buy those. And guess what? You have to do it yourself. Then we can diagnose the underactive thyroid. But the point here is all diagnosis is hypothesis, which we then put to the test. And if that person is clinically better for going carnivore, maybe taking a few supplements, sorting out their thyroid, correcting their mitochondrial function, detoxing, if they are they're full of their joie de vivre and they can get through a day with lots of it, then that's the true diagnosis.
Yeah, well said. Yeah, definitely.
I think we had another question from Nancy.
Oh, yeah, root cause, like looking for root cause, which is something that I do, and this is the approach that nutritional therapists generally take, is root cause of autoimmune. Is it really variable? Like it just seems to me, why would one person get one thing and not another? And I mean, a lot of diet always helps and is always to me the first line as well.
Okay. Well,
But it just seems like there's a lot of people who are still struggling and
correct.
wanting to find what is the root cause.
Okay. Well, there are three root causes of autoimmunity that we know without any doubt at all. One is the Voldemort factor, which you all know what I'm talking about. Number two is vitamin D deficiency, and everybody's vitamin D deficient. And number three are Western diets. We know that Western diets are a major risk factor for autoimmunity. Why? Because they're high in sugars and carbohydrates. Therefore, we get an upper fermenting gut, and therefore we get microbes which are not evolutionarily correct microbes leaking into the bloodstream. Now, the body makes antibodies against those microbes. It's got to kill them. If it doesn't kill them, you risk septicemia. And sometimes, through sheer bad luck, whatever, those antibodies against bacteria cross-react with self. This is called molecular mimicry. So one of the best examples of this is ankylosing spondylitis, which is a nasty inflammatory arthritis of the back. We know that that is allergy to Klebsiella bacteria in the gut. So if you are a particular tissue type, which is HLA-B27 positive, you make antibodies against Klebsiella, which then cross-react with spinal ligaments to drive inflammation there. And we now know that most arthritis is allergy to microbes from the upper fermenting gut. Rheumatoid arthritis, which is an autoimmune condition, we're making antibodies against self. But the mechanism of that is molecular mimicry. It starts with the fermenting gut. So as we've discussed, sort out the upper fermenting gut and you massively reduce the inflammatory drive in the body. Now, the trouble with the immune system is intelligent. Once it's learned something, it's difficult to switch it off. So what we do is we put in place everything we possibly can to reduce inflammation in the body. And the single most important intervention is cut out the sugars and carbs and get into ketosis. And that's why carnivore diet is so fabulous for autoimmunity.
Mm. And it's amazing because usually when it comes to autoimmune issues, what I see with people is the plants, and that's what's causing the most damage. And everybody's convinced that this is what they need to be doing.
I know.
And they have no idea this is what's actually causing the major damage because their gut has been unbelievably fermented. It's having an impact on the brain, and it's just everything's just rotten in your stomach.
And of course, the Voldemort factor is designed to switch on the immune system. That's why we use to hopefully switch on immunity. But of course, it doesn't work. Those Voldemort things have never been properly tested for efficacy or safety. So again, I could do a whole lecture on that, should you so wish.
Mm-hmm. Go ahead if you want to.
I have an autoimmunity question. I know that you have, Dr. Sarah, you have protocols, and I've read about them in one of your books, Ecological Medicine, the Groundhog protocols that you use when you approach treatment. I'm wondering if you could give us an overview of what those are and how you might, if you found something particularly stubborn in an autoimmunity, if you might apply some of your chronic or acute protocols to that.
Okay. Well, the protocols I call them Groundhog protocols because, like the film The Groundhog Day, it's a time loop, isn't it? The hero keeps coming back to the beginning of the day to try to relive it in a better way. I call them Groundhog protocols because I keep coming back to this stuff over and over and over again. So we should all be doing Groundhog Basic, which is the evolutionary correct diet, which is, at least a paleo ketogenic diet and for many a carnivore diet. We need a basic package of supplements, which includes vitamin D because we're all sunshine deficient, which includes vitamin C because we're all deficient in vitamin C, which includes iodine because we're all deficient in iodine. And then obvious things like good quality sleep, exercise and all that. And then I have what I call Groundhog Acute, which is what we should all do in the event of an acute infection. When I was researching for my book, The Infection Game, I appreciated then that nearly all chronic pathology has, if not an infectious associate, an infectious driver. So all leukemia is associated with some nasty virus. Many cancers are associated with some sort of viral or bacterial infection. Heart disease, ditto the same. Dementia, the same. So stopping infections getting in the first place is very important, and that's what Groundhog Acute is all about. And then as we age, we tend to, our biochemistry becomes less efficient, our immune system is less efficient. We have to work harder, and there are other things we can put in place as well, which I call Groundhog Chronic. So all these protocols, they're on my website, they're free for anybody to access, but it's just the overall strategy for tackling disease.
Can I ask a question about endometriosis and PCOS, fertility, and fibromyalgia? Because this is a big issue now in my country at the moment, especially for young teenagers, like 16 years of age. They're on these waiting lists for 2 to 5 years, and it's absolutely horrendous to watch. And I know a little bit about this area because I work with women at the moment, and I've actually worked with people that had these issues in the past, and they were able to manage the symptoms very, very easily. And when I reach out to these people and say, listen, this is an inflammation problem, trust me, it's an inflammation problem. They're looking at me and saying, well, what's your qualifications? You're not a doctor. You can't give me the advice. And it really frustrates me because the doctors are letting these people down. They're failing these people. Correct. They're just saying, okay, listen, they're just saying you need surgery. There's nothing we can do. But then someone like myself with my tinfoil hat on is just saying, well, listen, this could be down to your diet. What have you got to lose? Just Correct. Try it.
Correct.
And I've got a few testimonials to prove this. Every time someone posts up a video about endometriosis, I'm like, okay, don't listen to me. Listen to what this woman has said.
Correct.
Now, this woman has said many, many times her period pain is gone. She feels like she doesn't have endo anymore. I've interviewed many, many people on my podcast about this. It's really, really frustrating that I live in a country at the moment where I'm seeing young women at the moment that are going through this. I'm sure you see this yourself. They're on the ground, they're holding their stomachs, and it's honestly, from a parent, I have a daughter myself. I can only imagine what it feels like to be a parent watching your daughter on the ground in pain, and she's not getting the help that she needs. It's very, very frustrating.
And the point here, Mark, is the only science we can really trust are case histories. John Ioannidis, who's a Harvard professor of medicine, philosophy, he's the most quoted scientist in the world. He points out that over 95% of medical trials are set up. They're statistical rubbish. And they are there, put out by Big Pharma to try to persuade doctors prescribe in a particular way. But they're not science-based. They're not evidence-based. So always look for case histories, because that's where the true science is, because you are describing patients who have been cured, massively improved by your interventions. That is the important science. And we now know that PCOS, endometriosis, are an inevitable result of Western diets and Western lifestyles. And what we have to do is put in place all the Groundhog regimes, and then you'll start to see some results.
Yeah, I know. At the end of the day, we're the research.
Correct.
We're all the research that you need.
Yes.
You can argue as much as you like, but the one thing you can never argue with is the results. It really is that simple. How can you possibly argue? You can throw all these studies at me, as many as you like. Means nothing. Means absolutely nothing. At the end of the day, this person over here is telling me that she's not in any more pain at the moment. Did we just continue to ignore these people?
Correct.
It's just madness. What are you doing at the moment, Sarah? Are you actually full carnivore at the moment? What does your diet look like at the moment?
I'm not full carnivore. I'm meat heavy. My problem is I'm a gardener, so I don't have breakfast. I have lunch, which is usually I'm very lucky. I've got my own pigs, which will be usually meat and eggs. And then supper is obviously meat, and then I have a few green vegetables, and I have a few berries with coconut cream, and I find that totally satisfying, and I don't need any more.
And if there's anybody watching or listening to this podcast, and they're in a really, really bad way, and they're on the doctor's table, what advice would you give to these people? Like if they're looking at the situation at the moment, and they're like, you know what, there's no hope for me. There's absolutely
No,
no hope for me. I don't know what
what
to do. What advice would you give?
what I would advise them to do is to work it out for themselves. Because if they go and see doctors or consultants or physicians, they will just get symptom suppressing medication. So work it out for themselves from first principles. Listen to obviously to as many podcasts or whatever as you can, but you have to do it yourself. And there's not going to be anybody who is more motivated to get yourself well than you. There's not going to be anybody who can better monitor your symptoms and see response to treatment than you. And these regimes are within everybody's grasp to do. Okay, they might not be very cheap, because I'm mindful that meat and fish are not cheap commodities, but they're much cheaper than being ill. Because when you get your energy back, you can then conquer the world. You then have the energy to go out, sort out the family, hold down a job, and do all else. So these regimes, what we have to get out of is the addiction thing. And it's sugars and carbohydrates addiction, which drive addiction, which make us addicted to Western diets. So you really have to do it yourself. That's the message I would say to people. Just do it. Get the logic of what we're saying. And once you've got the logic, just do it, and then perceive. When you perceive those benefits yourself, you'll know that this is real medicine and it's working, and it's within all our grasps.
Yeah.
Wonderful
Food
advice.
food can be the best medicine you ever have.
Yeah.
And the second best
Nancy,
medicine is
do you
laughter.
have
We
another
need lots
question?
of good jokes and fun and giggles.
Yeah.
I'm sorry. Nancy, do you have another question?
I think I covered most of the questions. Did you have another one? I thought you still had something.
I'm
No?
good, and I would like to ask Dr. Myhill how people can find out more about her, and where to go,
Okay, well,
websites,
if you just
other places.
if you just go onto my website, there's loads of stuff there. It's free. There's no advertising. I've written books which are there and available. I run online Zoom workshops which people enjoy, where I chat away all day from 9:30 in the morning to 4 o'clock. Anybody in the world can join that, and the deal is anybody can ask any question at any time. I run workshops from my home, so which are good fun. We have lots of giggles, and we eat a very good diet, of course. So, but as I say, I try to make as much of my information as free as possible. I wish I could put all my book chapters on the website, but my publisher would go nuts if I did that, because nobody'd buy my books then, and she wants to make a bob or two. But the stuff on my website is free, so help yourself. And if you have any particular questions, you can always email me, and I will try and point people in the right direction.
Wonderful.
You know what? There was something we forgot to ask. Was
What's
just
that?
Dr. Sarah, if there was anything, we were wondering if you had a healing story, that if there was something in your own life that you needed to heal and that you found was healed through the diet.
Well, I've been very lucky. I've been blessed with good health. I got into all this stuff through allergy, and as a child, I was the snotty-nosed, asthmatic, wheezy, chesty person. And when my daughter, who I was breastfeeding, had terrible colic, I realised it was all about dairy allergy. And so that's how I got into all this. But allergy is a big player, so that's why a carnivore diet is so good, because it's low allergen. It's no milk protein, milk butter, yes, no gluten grains, no yeast. It's low allergen, and I wish I'd known about this in 1981 when I qualified.
Yeah.
Wow. So, Mark,
Definitely.
anything in closing?
No, I'm good. It's been an absolute pleasure, Sarah. I've learned so much from you, and I know you're a busy woman, so we can't thank you enough coming on our small show. It's just amazing.
My pleasure.
Yes,
If you want me
thank you.
again, just shout, and we'll find some other topic to talk about. I'm sure we can talk about something else.
Wonderful.
Absolutely.
Thank you so much, Doctor.
We'll definitely stay in
Yes.
touch. 100%.
Great. Cheers, Mark. Thank you. Thank you, Victoria.
Thank
Thank you,
you.
Nancy. Great
All right.
questions.
And Nancy,
Thank
yes,
you.
thank you guys. All right. Bye-bye now.
Say
Bye.
good night. Good